6B04 Social anxiety disorder. Social anxiety disorder is characterized by marked and excessive fear or anxiety that consistently occurs in one or more social situations, such as social interactions, for example having a conversation, doing something while feeling observed, for example eating or drinking in the presence of others, or performing in front of others, for example giving a speech. The individual is concerned that he or she will act in a way, or show anxiety symptoms, that will be negatively evaluated by others. Relevant social situations are consistently avoided or else endured with intense fear or anxiety. The symptoms persist for at least several months and are sufficiently severe to result in significant distress or significant functional impairment. Essential features of social anxiety disorder. 1. Marked and excessive fear or anxiety that occurs consistently in one or more social situations, such as social interactions, for example, having a conversation, doing something while feeling observed, for example, eating or drinking in the presence of others, or performing in front of others, for example, giving a speech. 2. The individual is concerned that he or she will act in a way, or show anxiety symptoms, that will be negatively evaluated by others, i.e., be humiliating, embarrassing, lead to rejection, or be offensive. 3. Relevant social situations are consistently avoided or endured with intense fear or anxiety. 4. The symptoms are not transient, that is, they persist for an extended period of time, for example, at least several months. 5. The symptoms are not better accounted for by another mental disorder, for example, agoraphobia, body dysmorphic disorder, olfactory reference disorder. The symptoms result in significant distress about experiencing persistent anxiety symptoms or significant impairment in personal, family, social, educational, occupational, or other important areas of functioning. If functioning is maintained, it is only through significant additional effort. Additional clinical features. 1. Individuals with social anxiety disorder may report concerns about physical symptoms, such as blushing, sweating, or trembling rather than initially endorsing fears of negative evaluation. 2. Social anxiety disorder frequently co-occurs with other anxiety or fear-related disorders as well as depressive disorders. 3. Individuals with social anxiety disorder are at higher risk for developing disorders due to substance use, which may arise subsequent to use for the purposes of attenuating anxiety symptoms in social situations. 4. Individuals with social anxiety disorder may not view their fear or anxiety in response to social situations as excessive. As such, clinical judgment should be applied to determine whether the reported fear, anxiety, or avoidance behavior is disproportionate to what the social situation warrants. Taking into consideration both accepted cultural norms and the specific environmental circumstances to which that the individual is subjected, for example, fear of interacting with peers may be appropriate if the individual is being bullied. Boundary with normality, include normal development fear or stranger anxiety in children, normal shyness. Course features. 1. Onset typically occurs during childhood and adolescence, commonly 8 and 15 years of age. Developmental presentations. 1. Social anxiety disorder is associated with the temperamental trait of behavioral inhibition, that is, the tendency for some individuals to experience novel situations as distressing and to withdraw from or avoid unfamiliar contexts or people. Behaviorally inhibited children are slow to warm up to new people and new situations. Behavioral inhibition is considered to be a normal variation in temperament, but is also a risk factor for the development of social anxiety disorder. 2. Similar to adults, children and adolescents may employ subtle avoidance strategies during social situations to manage their anxiety, including limiting speech or making poor eye contact with others. 3. Children and adolescents with social anxiety disorder may also evidence social skills deficits, such as difficulty with starting or maintaining conversations or asserting their wishes or opinions. 4. Social anxiety disorder symptoms may only become evident with the start of school, with the onset of demands to interact socially with unfamiliar peers and teachers. 5. The manifestations of social anxiety disorder may also vary across age groups, with younger children more likely to exhibit social anxiety primarily with adults, and adolescents more likely to experience increased social anxiety with peers. 6. Social anxiety disorder symptoms may become more evident with age as social demands exceed individuals' capabilities to cope with and manage their anxiety. Adolescents may exhibit various associated difficulties, including social withdrawal, school refusal, and reluctance to assert their needs. Some adolescents may participate in social situations for fear of the consequences to their social status if they do not, but do so with significant distress. Culture-related features. 1. Identification of social anxiety disorder may depend on assessment of social situations relevant for the cultural group that may be associated with excessive anxiety and whether the degree of anxiety is outside the cultural norms for the individual. 3. For example, among Japanese Taijin Kyofusho, and related conditions among Koreans, may represent a form of social anxiety disorder associated with the fear that others will be offended by one's own inappropriate social behavior, for example, inappropriate gaze or facial expression, blushing, body odor, loud bowel sounds. Differential diagnosis. 1. Generalized anxiety disorder can be differentiated from social anxiety disorder because the main focus of worry is negative consequences that can occur in multiple everyday situations rather than being restricted to concerns about one's behavior or appearance being negatively evaluated in social situations. 2. Boundary with panic disorder. If an individual with social anxiety disorder experiences panic attacks exclusively in the context of actual or anticipated social or performance situations, an additional diagnosis of panic disorder is not warranted and the presence of panic attacks may be indicated using the with panic attacks specifier. However, if unexpected panic attacks also occur, an additional diagnosis of panic disorder may be assigned. 3. Agoraphobia. Fear or anxiety in agoraphobia centers on imminent perceived dangerous outcomes, for example, panic attacks, symptoms of panic, incapacitation, or embarrassing physical symptoms, that are anticipated to occur in multiple situations where obtaining help or escaping might be difficult. Rather than on concerns that others are negatively evaluating them. Unlike social anxiety disorder, embarrassment in agoraphobia is secondary to the concerns that escape or obtaining assistance may not be possible should symptoms, for example, diarrhea in a public place, occur. 4. Boundary with specific phobia. 5. Boundary with selective mutism. 6. Boundary with autism spectrum disorder. Individuals with autism spectrum disorder and social anxiety disorder may both appear to be socially withdrawn. 7. Boundary with depressive disorders. Beliefs of social inadequacy, rejection, and failure are common in depressive disorders and may be associated with avoidance of social situations. 8. Body dysmorphic disorder. 9. Olfactory reference disorder. 10. Boundary with oppositional defiant disorder. 11. Boundary with other mental and behavioral syndromes due to another medical condition. Please share and subscribe.